As with any lifestyle change or physical exercise program, consult your physician before you begin your yoga practice. If you are pregnant, discuss your yoga practice with your yoga instructor. As your pregnancy progresses, you will need to modify or avoid certain poses. Move at your own pace and modify the poses as needed in order to maintain alignment and easy breathing in every pose. If you feel any discomfort, dizziness, or pain during your practice, either modify the pose so that you are comfortable or take a few moments to rest. It is very important that you listen to your body and practice yoga in the manner that is the safest and most comfortable for you. Namaste.
The next pranayama we're going to work on is called the cooling breath. And it does, in fact, cool down the system. The way it works is that the breath comes directly to the back of the throat and cools that area. Now, there's a little bit of genetic predisposition for this, and what I mean by that is there is a traditional positioning of the tongue that I can't do because of my genetics. It's a dominant trait to be able to roll your tongue. So don't worry, I found someone who can do that for you. But for those of you out there who are unable to roll your tongue, okay, you're going to do like I do when I practice this breath. All you're going to do is take your tongue and gently place it between your lips. When you do this breath, this is one of the few breaths that is actually inhaled through the mouth. Usually through all of your pranayama, it's through the nose, in and out. But this one you're going to use the mouth for the inhalation. So for those of you who are able to, draw your tongues out and roll their sides up so that they form a tube through which you're going to inhale, drawing the air. And again, for those of you like me who are unable to curl the tongue, simply slide the tongue between your lips. Gently press your sitting bones into the earth, and those sitting bones are the two bony points in your bum. Press them down, make sure you're directly above them. Lengthen the spine, vertebrae by vertebrae. Lengthen the back of the neck, the crown of the head to the ceiling. Allow your chin to tuck gently down. Widen your shoulders, your back. Allow the shoulders to slide down towards the tailbone. Draw your navel up and in. Slide your tongue out and either roll it up or slide it between the lips. Inhale through the tongue or over the tongue, directly to the back of the throat. Then draw the tongue back in and hold the breath. If the holding is uncomfortable, if you notice an increase in pressure in the sinuses, swallow slightly. As you swallow, the tongue will drop back, closing off the airways, avoiding any pressure arising to the sinus. For those of you with high blood pressure, don't retain the breath for as long as you think you can. Just hold until the body feels like it needs to breathe. At that point in time, exhale through the nose. Exhaling out of the chest, out of the rib cage, then out of the abdomen. For those of you without blood pressure problems, such as high blood pressure, low blood pressure, you're going to retain that breath for as long as you can. When the body says it needs to breathe, just relax. Release the tension from the body. Chances are you can continue to hold that breath. If, however, the body says, I still need to breathe, exhale from the chest, rib cage, and abdomen through the nose. So inhale through the mouth, draw the tongue back in, close the airway, and retain the breath for as long as you can. When you need to exhale, exhale through the nose. And that is the cooling breath.